Today I thought we'd talk a little bit about Botox. It's a very popular treatment and commonly requested. We get a lot of questions about these, so I thought that we'd just make this video to answer a couple of those questions and kind of educate people. So I'd say that in my practice, typically people come to me asking for Botox for a couple of different reasons. Generally, it's for signs of facial aging. I mean, there's really a variety of different things that Botox can treat, but really most people are using it for facial aging. And I'd say specifically the most common indications or reasons for it are people who want improvement in sort of the upper third of the face. This is sort of classically where Botox is typically used, as opposed to fillers, which classically are used in the lower 2/3 of the face. Now, these are all tools really, and plastic surgeons can essentially tailor these tools for every individual face, but in general that's sort of a framework, at least when I think about approaching patients, how I decide which agent is best. So typically Botox, what it is overall is it's a neuromuscular agent. It's a very weakened form of a botulinum toxin, and what it does is it very selectively weakens specific muscles. And so in fact, a number of years ago when Botox was first used, I think it was first used for ophthalmologic purposes, really for people who had one muscle that was deviating the eye sort of in a direction that was a little bit asymmetric from the others. So ophthalmologists would use that essentially to first kind of make the eyes a little bit more symmetric, and it worked very well. But a number of years ago, a very smart doctor decided, actually, if you look at the way that skin usually wrinkles, typically a lot of times we see wrinkling when people are in motion. For example, when you raise the forehead or the brow and you have these furrows, or when you frown and you have these vertical lines here, or when people smile and laugh and they have some of these crow's feet lines on the side. So I thought, well, maybe what we can do is we can use the Botox to actually selectively weaken those muscles so that when people are having their normal facial motions, the overlying skin won't really move as much and won't wrinkle. And they tried it. It was actually successful, and very pretty incredible cosmetic treatment was born. So I'd say nowadays in my practice, people typically come for Botox for any one of three specific areas. The number one most popular area that I see treated is really these vertical lines. Some people call them the 11s. They're really kind of when you furrow your brow and get these kind of lines in the middle here. And that's probably by far the number one most common area for treatment. The second area for treatment I see is sort of the crow's feet. These are the laugh lines that you see sort of emanating from the side of the eye. When people kind of laugh and smile, you'll see some of the lines on the sides there. That's the second area. And the number three area is really the forehead, which is where you have the horizontal lines that come across when people raise their brow, sort of like, and do things like this. Every face is different. If you watch any of my videos, you know that typically I emphasize that people really need to have all their treatments individualized, even something as simple as Botox. I mean, I'll see patients, for example, that one day I'll see a patient where they really have very severe lines here, but nothing in the forehead. Another patient that really has crow's feet and forehead, but nothing here. It really is very individualized, and so that assessment is really part of the treatment. Botox shouldn't be thought of sort of as something that you just kind of squirt in and it works, because it's really not like that. It's actually a very specific procedure and treatment that can be tailored specifically for the patient. So I think any one of these three areas works very well, actually. Good candidates for the procedure are patients who've taken a look and have specific areas, just like we mentioned, any one of those three areas. There are other uses for Botox, actually, too. Other good candidates for the procedure. One that's less known, and it's actually more known among the Asian patient population, but not as much known among the non-Asian population, is using Botox or neuromuscular agents essentially to sort of slim the jaw a little bit. If you feel down here, you'll notice there's actually a muscle here called the masseter muscle. It's a muscle that kind of gives us our ability to chew, but in some patients that muscle can actually be a little bit thick, and actually a little bit large, and it kind of gives a large appearance to the jaw. Now in Asian countries there is a very high premium placed on facial aesthetics. People really care about the facial aesthetics to a very high degree, and so a lot of these facial procedures are really pioneered in Asia. What they started doing a number of years ago, and very successfully, is actually to use a small degree of Botox here in these areas to actually, not specifically to weaken the muscle because of wrinkles, but really to actually use enough to actually help this muscle come down a little bit in size. And incredibly, it works very, very well, and actually can help some people for their jaw appearance to really come down in size a little bit. I see this mostly among Asian patients. Actually, quite a few Asian patients come to see me for that, we do the treatment works very well. Don't see as much among non-Asian patients, but my prediction is that eventually as the procedure becomes more well known, you'll see more non-Asian patients doing that as well. Things for patients to know about Botox. The effect is not immediate. It usually takes about 2 to 4 days to see some effect, and 7 days to see full effect. That's what I usually tell my patients. Side effects are very minimal. You can have some temporary swelling and bruising occasionally. In my patients, I would say honestly it's pretty rare. Botox is very well tolerated. I'm pretty careful with injections too, so bruising is very rare, but it can happen because you are doing a little injection, just like when you get like a vaccination. There's always a small chance you can get a bruise. But overall, it's really a very well tolerated treatment and works very well. It's super popular. It usually lasts about 3 to 4 months, and then that's about it.